COVID-19 cases continue to rise across the globe, with India breaking records, adding hundreds of thousands of new cases each day.
Meanwhile, administration of the Johnson & Johnson vaccine is underway once again. So joining us to tell us more is internal medicine specialist Dr. Abha. Thank you so much for joining us once again.
Good morning. Thank you for having me.
All right, doctor, let's first talk about Johnson & Johnson resuming their measures with their vaccine. What will that look like, and is it going to be limited to a certain amount of people who will get it?
Sure. Thank you for the question. So, there will be a warning attached to the J&J vaccine with regards to the very rare but present incidence of clotting, mostly seen in women under 50. And so people taking that vaccine or that jab will be apprised of that. I do want to point out the following. That appraisal was very sincere. Obviously, it put the J&J effort on pause for a couple of weeks here in the United States. Every medication that the FDA approves in the United States comes with some kind of warning, be that aspirin, be that steroids, be that a monoclonal antibody for people who suffer with rheumatoid arthritis or Crohn's disease. Please bear that in mind. We do a lot with regards to trust and faith in medications in order to live healthy and well. And the same must be considered for the vaccine. We know that COVID is claiming lives in far greater numbers than these vaccines have. So that is the caution.
Just to follow up real quick, doctor, with the vaccine for J&J, what are those people who are scheduled to see the Johnson & Johnson vaccine and do not want to do that? What would they be able to do besides that?
Certainly, there was a time, at least in our office, where you didn't choose. You got what you got. And certainly now that there is this J&J warning out, if people were to simply arrive at the site and say, do you have a Pfizer or Moderna for me? I'm just a little loath, a little concerned about the J&J. I have to believe that they would be offered alternatives at their pharmacies, at their primary care offices, or sent to the DeVos place where they are largely dispensing Pfizer.
Absolutely. And like you just mentioned, not long ago, we didn't really have a choice of which vaccine we were going to get. And now we're hearing more about the vaccine surplus. So kind of talk about why that is worrisome.
Right. I want to point out a trend that's exceptionally important to recognize. In the thick of COVID in Europe, we saw Italians falling by the tens of thousands. It was an exceptionally fearsome scene. And then it arrived here in the United States, and it became equally devastating, where we had governors clamoring for basic necessities like gloves and gowns, and then it went on to ventilators. We now have an opportunity to close out this pandemic's ravages in the United States and take a much needed vaccination. If we don't accept this vaccine and we see continuing plateaus and naders of people accepting these valuable vaccinations, imagine the day will come when the United States will simply ship these available vaccines to other countries in need. So if we were to set a deadline here in the United States, and this is speculative on my part, imagine what the implication will be for people who are yet hesitant. So when patients come to my office and they say, Doc, I'm still waiting, there may come a point when I, as their physician, say, you don't have much time. We will be closing out our clinics and our dispensing of these vaccines. I suspect there will be a greater urgency. So I think in a country that has enjoyed plethora and surplus, we might have to realize that while we are hesitant on a vaccine, there are nations the globe over who would do anything for these vaccinations. So please do the right thing, ask the right questions, and get that jab as soon as you can.
And doctor, we're running out of time, but I wanted you to touch on very quickly that double variant that's happening in India and what that could mean for the U.S. They're having some problems over there.
It's absolutely devastating. So that if you haven't turned on the news to see these makeshift cremation sites with fires blazing all over India, it's no different than what we were seeing with bodies piled up in New York City. The double variant is both more contagious and more deadly. It's spreading throughout India, and it has reached the United States, certainly not in the same numbers. But imagine, the only way we're going to know about variants anywhere in the world is if labs are testing for them. So if we continue to see spikes in our states, we have to imagine there must be evasive or mutant virus variants out there. We know that the B117 abounds here in Michigan. We also know that Michigan continues to lead this country in the number of cases. Please be vigilant. Please be safe. Wear that mask. Stay home if you are sick. Get tested if you are sick, and get that jab, because that double variant is not merely in India. And 300,000 and more have succumbed to the virus per day in India in the last week.